Let us continue part 2 of normal labor. So let us start pain during labor. So female have a lot of pain during labor. Why? Let us see. Because of the nerve supply, because of the nerves which get irritated. So coming to the nerve supply, let us see uterus. Uterus is supplied by T10 to L1 via hypogastric plexus. Okay, remember for uterus, hypogastric plexus. How to remember this? Just I remembered hypogastric uterus, HU. Okay, next coming to cervix and upper vagina. Cervix and upper vagina by S2 to S4 via pelvic, or you can say sacral plexus. Okay, next coming to lower vagina. Lower vagina and perineum, they are supplied by S2 to S4 via pudendal nerve. Okay, so now coming to pain during labor. The pain during labor is divided into first stage, second stage and third stage. So first stage of labor is also called as early or latent phase, and here due to uterine contractions via hypogastric plexus, you will have, that is T10 to L1, you will have pain. Whereas coming to second stage, that is also called as later or active phase, and here it is due to dilation of cervix. So here the pain is due to dilation of cervix. Here the pain is due to contraction of uterus. And coming to third stage of labor, it is due to stretch of lower vagina plus perineum. Okay, and the pain is due to via pudendal nerve. Okay, and it is supplied by S2 to S4. This is supplied by S2, this is also from S2 to S4. So both of them are pain referred to, both of this, either in second stage of labor or in third stage of labor. If the female have pain, that pain will refer to back. They'll also say they are having backache, right? So this is also called as true labor pain. So especially in the true labor pain, you will have back pain also. Okay, because of this fibers which are radiating towards back side. Now let us come to pain relief during labor. So how to relieve the pain? It is better to relieve the pain, right? Because it's very painful to give birth to a child. Okay, so we'll give parenteral drugs. So what are those parenteral drugs? Most commonly used parenteral drug is meperidine, that is 50 to 100 milligrams intramuscularly. So you are going to use 50 to 100 milligrams meperidine intramuscularly, and also you can use promethazine to 25 milligrams intramuscularly. Okay, promethazine. So maximum effects is seen within 45 to 60 minutes. Within 45 to 60 minutes you will get the effect, because you have given intramuscularly, and it will last for 4 hours. So you may think like it is taking 45 to 60 minutes to start its action, so it's better to give IV. But no, if you give IV, there are many risk side factors, like you can take aspiration is one of the side factor giving IV this drugs, and nausea, vomiting, respiratory depression in fetus. You will see respiratory depression in fetus, and low Apgar score, and especially if used in second stage of labor, okay, you will get low Apgar score. Now coming to another type of drugs which relieve the pain is regional blocks. So you can see here the regional blocks are divided into two types. One is the paracervical block, one is a pudendal nerve block. So let us discuss each of them. First, the paracervical block. The paracervical block is where you will block the pelvic plexus, which is carrying pain from the cervix to the spinal cord. So the pain is carrying from the cervix to the spinal cord. So now you want to block this. If you block this, the pain will not go, right? So to block this, you have a mediator, that is a pelvic plexus. You need to block this pelvic plexus. Okay, so the site where you are going to inject this injection, you are going to give it in the lateral fornix. In the lateral fornix of vagina you will give, especially you will give it in 2 or 4 o'clock position, or you can give either in 8 or 10 o'clock position. Remember, doesn't give the injection in 3 or 9 o'clock. Don't give here. In this position don't give, because there is a descending cervical artery. You may have a chance to pierce this descending cervical artery, so don't give the injection in either 3 or 9 o'clock position. It's better to give in 2 or 4 o'clock position, or 8 or 10 o'clock position. Okay, so you need to remember that the needle which you use is a spinal needle with 22 gauge. Okay, needle is spinal needle 22 gauge. And next, coming to drug, the drug which you are going to use to block this pain from the cervix to spinal cord is lidocaine. Okay, so lidocaine, actually it is 1%. You're going to use 1% of 5 to 10 ml on each side. Okay, maximum you can use 250 milligrams, or you can say 25 ml in total. Okay, for both sides. So this is how you use. And next, coming to disadvantages, very important. So what are the disadvantages? The disadvantages are, it is short acting, only for 2 hours it will act, and 15% of cases you will see there is fetal bradycardia. In the fetal heart rate, you will see the sound is very low, fetal heart rate is low, and 15% cases you will see fetal bradycardia because of cervical artery injury, or also you can call it at vasospasm. And this blocks pain. It blocks pain only from cervix, and it cannot be used in second stage. In second stage it is not used, and uses, so it is used only in first stage of pain relief of labor, and it is also used to repair cervical tear. So now let us come to the pudendal nerve block. So after paracervical nerve block, let us come to pudendal nerve block. So here we are going to block the pudendal nerve, and the site is at the ischial spine. At the ischial spine, this pudendal nerve is present. So at that place, and the ligament which is pierced is sacrospinous ligament, because sacrospinous ligament is at that level. So after piercing this only, we can pierce the pudendal nerve. So the drug which we use is same as the paracervical, that is the same lidocaine, and it is better than paracervical block, because let us see the uses of this pudendal nerve block. There are different uses, like the second stage of labor pain relief. It can relieve the second stage, whereas paracervical can relieve only first stage. And here there is instrumental delivery. And next, the perineal or vaginal tear repair. We can do here the perineal or vaginal tear repair. There we can do cervical tear repair. And next, it is not used. So of course it is not used in first stage of labor relief, and also it is not used in cervical tear relief. So now coming to the neuraxial blocks or epidural block. So among all the blocks, the best block which we use clinically is this epidural block. So actually we use this epidural block for the female to have painless delivery. So there is extreme pain in child delivery, normal vaginal delivery. So to prevent this, mainly the best method is epidural block, also called as neuraxial block. So this neuraxial block is the best block for painless labor. We need to block here upper T10 level. Upper T10 level is blocked. So the sensory is blocked and sympathetic is also blocked. So there is no motor block. But the disadvantages is, as you are blocking the sensory and sympathetic block, it is leading to hypotension in the mother. So there is low BP in the mother when you do this painless labor. So what is the drug of choice to do painless labor? That is the bupivacaine, which is given 0.0625% to 0.1%, and it can be used in both first and second stage of labor. So it can be used in both stages of labor. Now what are the effects of this epidural block? they shorten the first stage. As they shorten the first stage, some pain is reduced, and they prolong the second stage of labor by 1 hour. This is important. So this epidural blocks are going to prolong the second stage of labor by 1 hour, but doesn't increase the chance of cesarean section. No need to do C-section if you use this neuroaxial block, because we are using this block to do normal vaginal delivery without any pain. So now coming to sympathetic block. If you block the sympathetic system, it will lead to vasodilation. So because of this vasodilation, there is maternal hypertension, as we discussed before. So maternal blood pressure will drop, so the placental perfusion will also drop, because in the mother, if there is low blood, of course in the placenta also low blood, so that is leading to transient fetal bradycardia, because in the fetal now the blood is going very low, so it is leading to fetal bradycardia. And the treatment which you use here is IV fluids, and we need to place the patient in left lateral position. So if we put the patient on left lateral position and if we give IV fluids, even this hypertension will decrease. So next we can also give phenylephrine. Why we give phenylephrine is because if still it is not relieved by doing all these procedures, then we will give this. Okay, so if still not relieved, then give phenylephrine. So now coming to contraindications. Contraindications are like hypovolemia. Already if the patient is having hypovolemia and you are doing painless delivery, then it will lead to further hypertension. And whenever there is severe hemorrhage, we should never do this. In these both conditions, it is an absolute contraindication. Okay, so whenever there is increased ICT or local infection or any severe thrombocytopenia like less than 50,000 and fixed cardiac output, so all these are relative contraindication. Relative means like sometimes you can use, sometimes you not use. You can see in the cases of like fixed cardiac output, or in the case of severe mitral stenosis, aortic stenosis, it is a relative contraindication, because whenever these conditions are present, especially in heart failure mother, if you do normal delivery, that pain will in turn lead to more tachycardia. So normally in heart patients we do painless delivery, because we don't want their heart to get affected, mother heart to get affected. But here we are saying that it's a relative contraindication, so that's why we are saying it's not absolute contraindication. So now coming to level of anesthesia. So in normal delivery, we give level of anesthesia in upper T10 level, but here the level of anesthesia in cesarean section is, we give anesthesia at T4 level to block the peritoneum. In T4 level, we also want to block the peritoneum, so we give at T4 level. But normally, in normal delivery, we will give at T10 level. So finally, coming to true and false labor, let us differentiate them. So coming to true labor. True labor pains. True labor pains are seen in lower abdomen and it radiates to back and thighs. So in true labor pains, mother have pain in lower abdomen and also in the back and also in the thigh. Coming to false labor pains. In false labor pains, there is lower abdomen plus no radiation. So if there is no radiation, then you can say it is a false pain. True pain you have in the pain in back, thighs. Coming to contractions. In the case of true labor, you have regular contractions. In the case of false labor, you will have irregular contractions. And here the regular contraction with increased intensity and frequency and also duration of time will increase. But here it is irregular, so do not increase as labor progress. So they will not increase. Now coming to dilation of cervix. Here the dilation of cervix is present because it's a true labor. But here the dilation of cervix is absent because it's a false labor. Okay. And coming to show. Show means the blood which is mixed, blood mixed mucoid discharge is present, most weakly associated in the case of true labor pains. But in false labor pains, even that is absent. Coming to bag of membranes. Bag of membranes are seen here. Here the bag of membranes are not seen. And here the relief with sedation or enema is not relieved. Even you give enema or sedation, still pain is not relieved. But here if you give sedation and enema, it will relieve. So that's why it is a false pain. So one thing we need to note that show is not confused. Show is not to be confused with presentation of antepartum hemorrhage. So don't confuse the show with the presentation of antepartum hemorrhage. Preterm labor. Coming to preterm labor. Preterm labor, progressive dilation of cervix. Here you will have dilation of cervix plus pain in abdomen. So this is what we need to see. So by this we completed normal labor. Next we'll start with the abnormal labor in another video.